Hello, my name is Ashley and I'm the Field Application Specialist with Empire Genomics. And today I've put together a short presentation to help you understand how to run two different FISH tests on the same slide for the same patient using the circle slide protocol. So without further ado, let's jump into the presentation. So why use circle slides? Circle slides allow for laboratories to run two FISH tests for the same patient at one time. And this can be a really cost-effective and efficient method for running FISH panels, and it can help save money on slides. So I've underlined a very important part here and two very important words, and those words are same patient. It's very important that when you're using the circle slide protocol, the cells that go on each slide are from the same patient. You never want there to be patient cross-contamination and report the wrong results for the wrong patient. So it's very important to consider. I've also included an image here of the circle slides, and you can see that there are two circle wells on the slide, as well as an area to label the slide. So when should I use circle slides? Here's a few things to think about before running two FISH tests on one slide. The first thing again, and the most important thing is, are the tests for the same patient? You never want to report the wrong results for a patient. So it's very important that all cells going on a slide are from the same patient. So if a patient has been ordered two FISH tests, or maybe the doctor ordered a FISH panel for that patient, that's a really great time to use circle slides because a lot of the panels have 2, 4, 6, even 6 or more different probes that need to be used for that panel. So that's a wonderful time to use a circle slide because you can run two of those tests per slide. The next thing to think about is, am I running cell pellets or blood and bone marrow samples? If you're harvesting blood and bone marrow to make cell pellets, that's a perfect situation to run circle slides because you can drop interphase or metaphase cells into the circles to run your testing. The next thing to think about is, will my lab be able to appropriately label slides to correspond with the tests? It's really important to train your lab very well on this to ensure that the testing doesn't get mixed up and the results are reported wrong. It's very important to label what test is in each circle and make sure, of course, the patient name and information is labeled appropriately on the slide. So what about the protocol? Here are some 5 key points. So the FISH protocol is the same for running circle slides as typical blood and bone marrow FISH protocol. Now that means that the denaturation, the dehydration, hybridization, washing, counterstaining, they're all the same. The main difference is that you drop the cell pellet cells into each circle and you place different probes in the circle to run two different tests. Again, the patient would be the same and the cells in the circles would be from the same patient. You also want to be sure that you're using separate 22 by 22 cover slips to cover and rubber cement each probe. Finally, you still want to see about 50 cells per field of view within the circles on the slide. So what do the slides look like? Here is an example diagram that I just kind of threw together very quickly for you. There's a slide. You see the two circle wells there that will have the cells within it, about 50 cells per field of view as per usual. And then you can see that I've outlined these orange lines here representing the two 22 by 22 cover slips and the rubber cement that should surround all 4 edges of each of those cover slips. So again, step 1 is place 10 microliters of probe over the cellular area of each circle, and some labs will even lower the probe amount and use 8 so they have less overflow under the cover slips, and that's fine. You also want to ensure that the slide is properly labeled so the analyzer knows which test is in which circle. And again, that's very important because you don't want to report the wrong tests and the wrong results. Step 2 is place 2 individual 22 by 22 cover slips over the probes to ensure that no bubbles are left under the cover slip. And this is very typical of FISH testing. You always want to make sure that there are no bubbles under the cover slip so that the probe doesn't dry out overnight. And step 3, you want to seal the cover slip fully with rubber cement, and you want to seal each of those cover slips fully. and then continue to your denaturation and hybridization steps, which are just the same as your typical blood bone marrow denaturation and hybridization steps.